Sponsored by Texoma Medical Center.
Well, patients with fractures in their vertebrae often experience debilitating back pain and often find it difficult to perform the most basic daily tasks. Texoma Care neurosurgeon Dr. Abdul Baker joins us today to talk about a procedure called balloon kyphoplasty that assists people with these injuries. Thanks, Dr. Baker, for being with us today. What is this?
Balloon kyphoplasty is a minimally invasive technique to treat patients who've suffered spinal fractures.
And who's going to be the best candidate for this procedure? Everyone who has a spinal fracture?
No. The patients who are at risk for this type of fracture are patients who have the condition called osteoporosis. That means weak bones. So certain anatomic features of the fractures need to be present to qualify for this procedure. One feature about this technology that's good is that not only do you inject, this technology involves injecting cement in the fractured bone, but instead of injecting cement into the fractured bone, you're actually creating a cavity, and most of the time bringing the bone back in normal alignment prior to injecting the cavity versus simply injecting the cavity in a fractured bone in its current state. So that improves alignment, and patients do very well with it.
Yeah, that sounds great. So walk us through that procedure a little bit. How is this performed?
This procedure is performed under general anesthesia typically, or you can also do it under local. With x-ray guidance, you make two cuts that are around 3 millimeters or so on either side of the fracture from the back, and use x-ray guidance to insert a probe right in the center of the fracture and insert a balloon to create a cavity and inflate the fracture, inflate the bone to pre-fracture height, and then start slowly injecting cement. So you're basically reconstructing the bony anatomy like it was before the fracture.
Yeah, and what's the recovery time for something like this?
Patients who are very symptomatic with pain, who have vertebral compression fracture that meet criteria for kyphoplasty, the effects are immediate. It's an outpatient procedure. They can literally walk, they can go home within an hour after the procedure.
That's amazing. Life-changing in an hour. Thank you, Dr. Baker, for being with us today. We'll be right back.